Good evening, everybody. John Robinson, aka the Hospice Guy. Here we are on November 12th, and we are going to talk about the patients withdrawing from social surroundings, being, let's say, withdrawn from just the normal things of life that we all take for granted. And I'm going to read from my book a little excerpt, so please bear with me right here. Beginning months to weeks, probably at the time of diagnosis, my journey home, I will begin to withdraw from you and the people around me socially. I do this for the following reasons. I have a journey to prepare for, and this is the time for me to pray and make things right between me and my God. I may appear depressed, which is normal, because I will soon be leaving the life and the people that I love. I definitely will be sleeping more. All this is in order to be done to begin the separation process, making my journey easier for me and for you. I may not want to talk as much as I normally do. I may not smile as much as I once did. What I am going through is difficult to accept. And I probably don't know where or how to express myself. Therefore, I withdraw. Ask me if I am okay. I welcome your questions. I always said my faith will get me through, although I wonder if there is a heaven and what is promised me. I am scared, I am apprehensive, and I am skeptical. I know my time is short. My God has shown me this. I know I am passing soon, and I will leave this world. Does this explain why I am the way I am? I hope so. I love you. You know, the thing with this, with being withdrawn, there's all various stages as a person goes from the point of diagnosis to treatment, to stopping treatment, to bringing hospice in. But once I alluded to before, when you're sick, you just don't want to be around people. You know, you're facing something drastic. You don't want to be around people laughing. You don't want to be joking. Some people do, but most people don't. So just be conscious of others people's feelings. That's probably a big thing. And think about it. If you're a young person with an end-of-life disease, you know what? You're going to get depressed. You're going to withdraw because guess what? You may not see your kid graduate from high school. You may not see your kid, get married, have their first baby. You may not become a grandmother, grandfather, whatever the case may be. Put yourself in the patient's shoes. Withdrawal is going to be normal. Just, you know what? The most important thing I would say for the caregiver is just be there. Offer a shoulder, offer an ear, offer a hand to hold. Sometimes words are not needed. Sometimes words are more of a pain in the you-know-what than they are a comfort. So just letting that person know that you're available 24/7 for them if they ever need to speak, want to talk to somebody, that is paramount for the patient. And what I had said earlier about not wanting people at your house, coming in, dropping in with food, especially towards the end of your life. You don't feel like eating, and people are bringing over spaghetti, cookies, lasagna, they're bringing over pies and all this stuff. And sometimes it's just more of a discomfort than a comfort. So this is something I tell my families to do, just in case somebody doesn't get the message. When they decide they want to surprise you and come to your house, I always tell, you know what, post a sign for the people who are drop-ins. You have to. You have to take control of your life. And I know there are times I don't want people around me at certain times of the day and stuff like that. So it's okay to do this. Here's a little poster you can put on your door. Please call ahead and plan your visit. My loved one is not feeling well today. Thank you for understanding and being respectful of his or her needs. You know, you leave your telephone number there. And believe it or not, that is probably one of the most repeated phrases that I hear my patients say and post on their home. So once again, withdrawal, it's a normal progression. I believe anybody diagnosed with a end-of-life illness or an end-stage illness should be placed on an antidepressant without a doubt. Because all too often, that part of the person's psyche is left untreated. So that's where the family members and or the nurse who comes in there has to be acute to those signs and symptoms of depression and address those. And maybe get on a antidepressant or something to help with the mood, because it is, oh man, for lack of a better word, depressing. You know, with that being said, my name is John Robinson, aka the Hospice Guy. May you all be blessed, have a good evening, and we will see you tomorrow night, and we'll talk about our pets tomorrow night. I think that's important. So once again, God bless.